Not less than 50 people have died this year following the outbreak of Lassa Fever across the country. Today on Soundhealth, our focus is on curtailing further spread of the disease. I'm Olasumbo Modupe. Welcome to the show. Welcome back. It's still Soundhealth on Lagos Television, and today we are looking at Lassa Fever, how to curtail the further spread of Lassa Fever in Nigeria. And I have with me a public health physician, Dr. Doyin Ogunyemi. She's also the Public Relations Officer, Association of Public Health Physicians of Nigeria, Lagos State Chapter. Welcome to the program, Doctor.
Thank you for having me.
Okay, in the last few weeks, about 50 people have died as a result of Lassa Fever, and more are under surveillance. How did we get here?
Lassa fever is a viral disease, meaning that it's caused by a virus. And it has been with us in Nigeria for many years now, since the first outbreak in northern Nigeria. So the problem is that it keeps recurring because the conditions for Lassa fever to spread remains with us. And this includes things like our basic sanitation. As long as we have space for rodents to run around, then that is what carries the vector that carries the disease. It's a kind of rat. But as long as we have heaps of rubbish here and there, we'll have the rats coming into homes and infecting our food substances that we eat, and thereby having the spread of Lassa fever.
Okay. We all know Lassa fever is caused by infection from rat droplets. How do we know the exact species of rat?
A multi-mammate rat, that's a rat that has multiple breasts. But I'm not keen on saying this is the name of the rat, because you can't go about chasing for rats and then checking and say, is this the type of rat? No. So in short, it is unhealthy to have rats living where people are living. So once we can de-rat our areas, then we can have healthier living.
Aside from fever, especially hemorrhagic fever and weakness, what are the other signs and symptoms of Lassa fever?
Okay, so I'll just back up a bit to link up that it is when rat urine or feces get into the food we eat and the food is not properly prepared that we can get Lassa fever. Or when a sick person, the secretions from a sick person, either the urine or the feces of the person or the vomitus touches the hand of a person, that is how it is spread. How do you know? It mimics other kinds of viral illnesses. So fever, nausea, vomiting, stomach pain. But what is really special, or what distinguishes Lassa fever, is the fact that you now have bleeding. So you could have bleeding from the nose, from the mouth, from the skin. That gives the index of suspicion. But by the time the person is having those kind of symptoms, then you know that the person has already started infecting other people.
What is the level of prognosis and the incubation period of this condition?
The incubation period is 6 to 21 days, like all kinds of hemorrhagic fever, Ebola and so on. That means that the person has up till 21 days to manifest the first symptom of fever. And that's why people must be kept under surveillance. The prognosis, there is a drug treatment for Lassa fever. That's the beauty. However, the problem is a high index of suspicion. So when somebody presents first, maybe to a health center, and presents with fever and neck stiffness, the person, they may not suspect that this person is having Lassa fever. And then they then see that the person is not responding to anti-malaria and so on, and then they refer. When they refer the person, and you go on, and that is what makes Lassa fever spread. Now, if treatment, which is a drug called ribavirin, is started within 6 days of the disease starting, then the person gets well. So the prognosis is good if treatment is started early. And treatment can only be started early if the diagnosis is made or it is suspected. And that's why when there's an outbreak, we want to tell all health workers that keep in mind it may just be Lassa fever. And that takes us to the issue of precautions. We need to still invest more in health, because many times universal precautions, and when we say that, we talk about hand gloves, wearing goggles, face masks, and things like this. There should be a standard way we deal with everybody who is sick. It is not only when it is Lassa fever. When it's Lassa fever, you need to then take up your game a little more. So we should have general precautions. Even the people cleaning the hospitals who don't even know this patient has Lassa fever should do so wearing gloves and taking care of themselves. Hand sanitizers, all of these things should be around hospitals, especially now.
More people are suspected to have Lassa fever, and hundreds are being placed under surveillance, with recent case in Kwara State. Unfortunately, they have limited diagnostic centers in the country.
You are correct, because sometimes some people, it may be, it may not be, they'll say there's a strange illness killing people. And the reason they can't quickly name it is because they don't have the diagnosis. So imagine the time of sending a sample, sending the sample down to maybe Lagos virology lab in Luth, getting back the results before you then say it is the problem. So it takes me back to where I started from. We need to invest more in our laboratories, in our research. We don't have a vaccine for Lassa fever. If we have a vaccine for Lassa fever, like we do polio and the rest, then it will become a thing of the past. So we need to, when we are spending 4 to 5% of our funding on health in a country like Nigeria with so many people, then we need to do more. The government needs to do more to make sure that we speed up things and people can get well quickly.
Okay, is there a cure for the condition?
Yes, the treatment, there's a drug.
Okay.
So what do we have to do? What we have to do, back health education, let people know that please keep your food covered. Things like gari that we just put in water and drink. You know, many times people dry these things outside the home and rats get there. So all food should be covered in containers in the home. Keep your environment clean. Cut bushes around you. Don't live with rats. Don't say, that's the rat, is our friend. Put killers, make sure you kill all rats around you. Wash your hands before cooking. Cook your food properly. Eat clean food. If you suspect that you have a fever, go to the hospital. At the hospital, let health workers have a high index of suspicion that it may be Lassa fever. If the symptoms are there, let them report. Do not hide cases. Surveillance should be ongoing. That means that people should report. And even the Ministry of Health, like the Lagos State is doing, should look for these cases actively. They should be isolated. Isolation centers should be on top of the game, and they should be treated. Once we do this, if treatment starts on time, people do not die. The 3 doctors who were suspected have all been discharged before a 4th case was then diagnosed last week. So we can do what we can within this ambit. However, the bigger plan is to have a vaccine so that people don't even get Lassa fever.
Talking about vaccines, is there any ongoing research to advance treatment of Lassa fever in the developed world?
So, Lassa fever is one of the kind of diseases we will call a neglected tropical diseases. Neglected tropical diseases are diseases that generally are in poor countries and do not fly to more modern countries. Therefore, we must realize that if a disease is not in the developed world, it doesn't make economic sense to prioritize funds in trying to develop vaccines for it. So that takes us back to us, that we should realize that Lassa fever is a problem in developing countries like Nigeria. And so our medical labs, the NIMA is there, which is our medical research lab. I trust that things are ongoing, but year in, year out is the same problem. How far have we gone? Where is the problem? Is the funding there to make sure that we get? It's really an expensive thing to get a vaccine. You have to do lots of trials.
Okay. Do you see Lassa fever ending soon? Because you will hardly find any house without rats in the country.
I think it can end if we have a multidisciplinary approach to it. So let the sanitary workers do their work. Let the health workers do their work. Let the government provide its funding. If everybody's hand is on deck, of course, we had smallpox has been eradicated. We are this close to eradicating polio. We can if we put everything on the table and make sure everybody is doing their job.
Okay. Thank you so much, Doctor, for sharing your thoughts with us on Sound Health.
Thank you for having me. It was a pleasure.
All right, that was Dr. Doyin Oguyemi, a public health physician, on curtailing the further spread of Lassa fever in Nigeria. She's also the public relations officer of the Association of Public Health Physicians of Nigeria, Lagos State Chapter. Sound Health continues with trending and home essentials. Please stay with us. Welcome back. It's still Sound Health on Lagos Television. I'm Olasumbo Modupe. Innovation this week is up next. Please stay with us.
Cellular immunotherapy to treat leukemia and lymphomas.
Are we getting closer to a better treatment for cancer? Treatment for many cancers remains mostly as surgery, chemotherapy, and radiation therapy. Unfortunately, for patients whose cancer returns after intensive chemo and other traditional treatments, options are close to none. There's promising news coming for children and adults fighting the battle with leukemia as well as non-Hodgkin's lymphomas. One of the first cellular immunotherapies is about to hit the market, and early results suggest that these diseases, even in advanced stages, may be curable. T cells are units of the blood critical to the immune system's ability to detect and kill cancer cells. Chimeric antigen receptor, CAR T cell therapies, represent a type of immunotherapy where T cells are removed and genetically reprogrammed to seek and destroy tumor cells. The groundbreaking treatment is expected to be presented to the FDA in 2017, with hopes to trigger a wave of approvals for many blood cancers and lymphomas.
That's Sound Health this week. Hope you've learned a few things about Lassa Fever. Please share your thought with us on 0818-815-3695 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.